So let's get right into it. First of all, what is Lewy body dementia and how is it distinct from Parkinson's disease? It's actually very difficult to diagnose LBD because some of the physical limitations of LBD very closely mimic Parkinson's disease. In fact, Parkinson's disease can be a risk factor that can lead to LBD, which is even more confusing. First of all, Lewy body dementia is essentially because of or caused by protein aggregates called Lewy bodies that form in the brain and cause damage. Lewy bodies are formed by the protein aggregate Alpha-Synuclein, which in previous videos we've covered the role of Alpha-Synuclein, or at least the presence of Alpha-Synuclein in Parkinson's disease and even in its diagnosis. So the fact that Lewy body dementia is caused by Alpha-Synuclein is very intriguing and also very enlightening. Parkinson's disease in and of itself can be a risk factor that can lead to LBD, as well as other disorders such as REM sleep behavioral disorder. REM sleep behavioral disorder we've talked about in a previous video that I'll link above, and that is a condition that can be associated with PD, but can also be a hallmark of Lewy body dementia. So again, signs and symptoms of Lewy body dementia. As a typical rule, the cognitive issues will develop first and then the physical limitations tend to follow afterwards. One of the hallmarks of LBD is visual hallucinations. In fact, up to 80% of persons diagnosed with LBD will have some form of visual hallucinations that need to be treated with medication. It could even be hallucinations of an auditory or an olfactory nature where you smell and hear things that aren't there. Like Parkinson's disease, you can also have a direct reduction in acetylcholine in the brain. And as you may recall from previous videos we've done talking about cognitive changes in PD, again, I'll link that above, we've talked about how acetylcholine plays a role in attention and memory. And LBD directly results in a decrease in acetylcholine and also in dopamine, which is what will lead to the movement disorder part of the disease as it develops. So in addition to the hallucinations, there can also be present of unpredictable changes in alertness and attention, as well as in wakefulness from day to day and even throughout the day. In addition to that, thought processes can be illogical and unclear. Severe loss of thinking abilities can interfere with activities of daily living. So folks with LBD really need a lot of help with activities of daily living as the disease progresses. So the movement problems with LBD can be very similar or almost exactly the same as Parkinson's disease. You've got rigidity and stiffness, balance problems, a shuffling, slow walk, frozen stance, tremoring or shaking, balance problems, repeated falls, I may have said balance already, stooped posture, loss of coordination, masked facial expression, difficulty swallowing, and a weak voice. Now to the outsider that would look just like Parkinson's disease, but in fact this may progress later rather than first. Whereas in Parkinson's disease the movement disorder tends to happen first, and then if dementia is developed, which isn't always guaranteed, it tends to happen later. Sleep disorders are very common with LBD. Among the most common are, as we mentioned before, REM sleep behavioral disorder, excessive daytime sleepiness, insomnia, and restless leg syndrome. In terms of behavior and mood changes, tend to see similarities to other forms of dementia, but I'll mention them anyway. You tend to have depression, anxiety, apathy, agitation. You can even have delusions and paranoia. That can be really difficult, especially when you're living with a loved one with LBD. Again, similar to Parkinson's disease, you can also have changes in body temperature, blood pressure regulation issues, dizziness, frequent falls, sensitivity to heat and cold, sexual dysfunction, urinary incontinence, constipation, and poor sense of smell. So again, in terms of terminology, seriously, when it comes to the term Lewy body dementia, it really refers to two related diagnoses: dementia with Lewy bodies and Parkinson's disease dementia. And honestly, the difference between the two is mainly which symptoms come first, the cognitive or the physical or the movement limitation disorders.